Hi everyone, and thank you for listening in to this webinar today. We'll be talking about two tools that can be used as part of chronic disease self-management to promote well-being and better health outcomes in chronic blood-borne viruses. Before I begin, I would like to acknowledge the traditional owners of the land on which we are meeting and learning today, the Wurundjeri people of the Kulin Nation. I pay my respects to their elders past, present and emerging, as well as their continued connection to land, sea and community. So today we'll be talking in a variety of different contexts around two tools that can be used supportively in general practice. One of those is the LiverWell app. It is an app that has been developed for the self-management of viral hepatitis as well as liver disease. And we know that, for example, with hepatitis B, that the rates of engagement in care and the number of people who are not engaged in regular care are not where we would like them to be, as well as the treatment rates for Hep C and also with liver disease growing quite quickly. It is something that can be quite useful in practice as well. We also know from hearing people's experiences that being diagnosed with viral hepatitis can be something where there's not a lot of information that is easily accessible. It can be really difficult to find information and quite overwhelming. And this is something that can be used at that point as well. The other tool that we'll be talking about is the PozQol tool, which is a wellbeing self-assessment tool for people living with HIV that can be used both independently and in general practice. And given the ongoing and chronic nature of HIV, it is something that is really important to be mindful of someone's wellbeing throughout that time. There are a lot of ways that you can support people to manage their health and wellbeing, and these are only two of those. But they are something that can be really useful to help inform discussions and conversations, and as well as sort of to promote ongoing management and communication between both doctors and clinicians, as well as patients. And it's definitely something that can't be understated, is the importance of GPs and trusted clinicians recommending tools and avenues of information that they trust that can really help with uptake and ongoing positive health outcomes. So just to set up some context for our next two speakers briefly, and we'll go into a little bit more detail as well as some resources available around this later. But I just wanted to give a little bit of a brief overview of the LiverWell app, one of the two tools. And it is something that was relaunched. We had an update recently, and it's a free app that's available to support liver health and self-management of liver health. And there's two real elements to this. One is that it is a source of information. People can get questions answered and contact people for support. But there's also tools that can help people manage their own health. So things like being able to schedule medications, record results and visually track results over time, record notes and keep track of appointments as well. And it is something that was developed in collaboration with consumers that have a significant amount of consumer input, which means that it is something that is quite relevant and has had that guidance as well. And I think it is just a really useful tool for both clinicians and patients to use together to help with that communication. So now I would like to hand over to Dr. John ODonoghue, who is an S100 prescriber GP, and who's going to talk a little bit about the value of self-management tools with a bit of a clinical lens. So thanks, John.
Thanks, Isabel. In practice, when we're trying to treat people with chronic diseases, quite often the biggest problem is getting them to take some ownership of their treatment. Quite often they just want to come to the doctor and get the quick fix, which doesn't tend to work unless they take ownership of their treatment. It doesn't tend to necessarily progress as well in the long run. I mean, hepatitis C is obviously not as bad as it used to be in the past, but it's still obviously a lot of people with cirrhotic problems who need a regular follow-up. So any tool that can help to get people to take more ownership and control of their treatment is going to improve their outcomes. I feel it's very important that we actually involve patients in their treatment. And this isn't just in blood-borne viruses, but most of the chronic illnesses that GPs treat. So apps like this can be very important. Have you got any questions you'd like to ask me?
I was just thinking, John, while you're talking, I think that's such a valid point around, supporting proactive healthcare amongst patients. Are there any avenues or suggestions that you have for clinicians that they could sort of try to maximise that or begin to build some of that into their practice?
Well, it's a matter of when we have a consultation, is it quite often at the end of the consultation, the patient expects you to take on the burden of their illness, whatever it may be, and it's a matter of actually handing it back to them and saying to them, well, this is what we suggest, but what are you going to do? What decisions are you going to make in relation to your illness? So they can actually get them involved in the whole treatment process.
And are there any tools that you use to help support that? Maybe that varies by diagnosis or something that you use generally?
Well, there haven't been many good tools around to actually get patients around. Obviously, things are changing with much more technology now than there used to be. In the past, actually sometimes even getting them to use a diary has been useful in the past, if you can actually get them to record stuff in it and use it to remind them when they need to do things. Because a lot of the patients just forget that they need to do stuff. So like doing a hepatoma screening every 6 months for someone who's cirrhotic, they don't always come back. So if they haven't got some sort of reminder, how do you get them to do it?
Have you had any success with avenues in the past of how to sort of support those reminders and encourage people to return for those screenings?
Well, you put recalls in, and you can send them a recall letter. Sometimes, though, the real problem is that a lot of these our patients are quite transient, and you may try and chase them, but they've actually moved somewhere else or they've changed their phone number. So if they have something that actually helps them to take control.
Do you have any thoughts or advice around supporting patients through change and what that can look like?
Quite often it actually comes down to you've got to make it that people have to see that they're going to gain something from change. People won't change just because you tell them to. They've actually got to see that there's some positive outcome for them in changing. If they can see that there's something that they will gain from their change, they're more likely to do it.
Thank you so much, John. That's been really, really insightful.